Hello, my name is Isabella Brothers. Today I will be sharing my research with you entitled The Value of Histology in Forensic Autopsies. Histology is defined as the study of the microscopic anatomy of cells and tissues. Histology is used in the field of forensic pathology for detecting certain diseases, more closely assessing observable injuries to the body, confirming the cause of death in very specific cases, and monitoring epidemics and pandemics. Histological techniques consist of fixing a collected tissue sample, sectioning that tissue sample into smaller pieces, and staining the tissue sample for future analysis under a microscope. The use of histological techniques in forensic pathology has sparked some debate. Medical examiners do not agree on whether histology should be used in everyday practice or only used as necessary. Its use depends on the forensic pathologist. Because of this, histology in practice varies among different medical examiners' offices globally and remains unstandardized. In the articles provided, histology rarely altered the cause of death determined already by gross autopsy. However, it was also found to be useful in differentiating between different causes of death and resolving previously undetermined causes of death by identifying evidence in the tissues of natural death. There is a push for the forensic sciences to standardize practices to improve the validity and reliability of forensic evidence in court. Without standardization, the risk of wrongful convictions significantly increases, which severely damages the lives of innocent people. In cases involving histology, details related to a cause of death may be missed without the regular use of histological techniques. Histology is mostly used in cases involving embolism and myocarditis. Embolisms are classified by the release of fat or fluid into the bloodstream and can result in the obstruction of arteries. Myocarditis is inflammation of the myocardium, or the muscle in the heart, that is typically caused by a viral infection and affects the ability of the heart to properly pump blood. Histology additionally allows for the study of lacerations, contusions, and fractures that may or may not be macroscopically apparent during autopsy. Most medical examiners will conduct histological analyses for cases of sudden infant and maternal deaths, electrocution, drowning, hypothermia, and fire. They may also conduct these analyses to diagnose or confirm cause of death, document newer known pathologies, educate medical professionals or students, and in recent times, study the effects of severe acute respiratory syndrome caused by a SARS-associated coronavirus and COVID-19. The images on the right show the pathology of COVID-19 in the lung tissues of two patients with COVID-19 pneumonia. They depict histologic changes in lung tissue due to fluid leakage and inflammation. These examples emphasize the importance of histology. To evaluate the use of histology in confirming pathologies that contributed to cause of death, the present study selected two cadavers in the RU Biology Department cadaver lab. The first cadaver was a female who died from heart failure at the age of 90, and the second cadaver was a male who died from complications related to a ground-level fall at the age of 76. In a concurrent study in the Biology Department Histology Lab, I am assessing the hepatic implications of heart disease and heart failure, so I collected tissue samples from the right and left lobes of both cadavers' livers to simultaneously examine liver abnormalities and fatal pathologies. The male cadaver served as a reference for a normal liver. These tissue samples were isolated with a scalpel and placed in deionized water to rinse them of the various chemicals used for cadaver preservation. The liver tissues were previously fixed in 10% neutral buffered formalin to preserve the tissues and prevent natural decomposition and enzymatic breakdown. Tissues were stored in 70% ethanol for 24 hours to prevent them from completely drying out and fully hydrating. Dehydration of the tissues by use of increasing ethanol concentrations was important to remove the water that is naturally found in the tissues of our body. This is essential for the infiltration of paraffin wax into the tissues to permanently preserve them. Paraffin wax is hydrophobic, meaning that it repels water and cannot mix with it. Collected liver tissue samples from the left and right lobes of both cadavers were cut with a scalpel again into smaller pieces that were placed into the tissue cassettes depicted in the image to the right. Infiltration of the paraffin wax into the liver tissues required heat to melt the wax for submerging the tissue cassettes in. Once the wax cooled and hardened, tissue blocks were formed. Tissue blocks were cut with the blade of a microtome instrument, an example of which you can see to the right, to produce even, thin sections of the liver tissues. These sections were collected from the blade with a paintbrush and positioned very carefully on microscope slides. Microscope slides required 1 drop of deionized water for tissue adhesion. These slides were placed on a slide warmer to dry for about 24 hours. Prospective work will consist of staining the tissues on the microscope slides with hematoxylin and eosin dyes. H&E stains are very common in histology and forensic pathology for examining tissues of interest. The lower right image is an example of a tissue sample that was stained with H&E dyes. The cell nuclei, or the darker round portions of the cells, are stained blue or purple with hematoxylin. The pink portions of the cells, or the cytoplasm, are stained by eosin. The process will be completed with the addition of cover slips to the microscope slides. Light microscopy is used to view and magnify tissue samples for identifying normal or abnormal characteristics of the tissues. For this study, a light microscope with an attached digital camera will be used for capturing images like the one provided on the right. This example is an image that I took from a prepared slide of pig liver tissue. This serves as a reference image of normal liver tissue and represents the results I expect to find in the liver tissue of the male cadaver with no known hepatic abnormalities. Although this study is still ongoing, I expect to observe differences in the liver tissue of the male and female cadavers with different causes of death. I anticipate that I will confirm presence of disease in the liver tissue of the cadaver who died from heart failure, and thus support her cause of death. Results will be reported after data collection concludes. The results from my study contribute to the effort in assessing the value of histology in forensic autopsies and standardization of the practice in the field. If my results confirm fatal pathologies in the liver tissue of the female cadaver with heart failure, they will emphasize the value of microscopically studying diseased tissues to produce forensically significant findings that are not evident during a macroscopic autopsy examination. Although the process may be time-consuming for a medical examiner, instances of uncertainty in reporting a certain cause of death would benefit from histology to increase the validity of observations. Whether histology is used in everyday practice or infrequently, standardization must be achieved to support the reliability of forensic pathology evidence. If you are interested, my references are included in the provided QR code here.